Today's video is all about 9 subtle yet powerful warning signs of a stroke that can show up weeks before the event itself. In the United States, someone experiences a stroke every 50 seconds. What many people don't realize is that your brain often begins sending urgent signals well in advance. Recent studies have shown that nearly 4 out of 10 individuals reported noticeable symptoms in the days or weeks before their stroke. The tragedy is that these red flags are often brushed off as simple everyday discomforts. Before we dive into these potentially life-saving clues, let me welcome you if this is your first time here. Our mission is to give you the knowledge and confidence to protect your health and possibly save lives. Be sure to click the like button and subscribe so you're always updated with our latest health guides. Your journey towards stronger health and stroke awareness begins right now, and we're honored to walk this path with you. And don't forget, drop your country in the comments. We love seeing the voices of our worldwide health family. In this video, we'll uncover 9 important early warning signals that may appear weeks before a stroke occurs. These aren't just random complaints. They are well-documented indicators that blood flow to your brain may already be under threat. By the end of this discussion, you'll be equipped to recognize the signs your body is pleading for help, giving you the chance to take action before disaster strikes. Please remember, this video is meant for educational purposes only and does not replace medical advice. All facts are supported by research, and you can find the references in the description. Now, let's get started with the early symptoms of stroke that may reveal themselves long before the attack happens. 1. Atypical neurological clues. The early warnings cover a scatter of odd neurological changes that may not seem connected at first, but together can signal rising stroke risk. These can include a sudden fogginess or trouble making sense of speech, brief seizure-like spells, waves of nausea or vomiting with no clear trigger, or even short episodes of blackout. Large cardiovascular and neurology cohorts report that such symptoms can precede a stroke by anywhere from the same day to several weeks beforehand. Part of why these signs slip past us is their subtlety. Confusion gets blamed on fatigue or age, and abrupt nausea is written off as something you ate. Yet when these issues cluster or repeat, especially in people with risk factors like hypertension, diabetes, or vascular disease, they may reflect the brain's many ways of signaling strain on its blood supply. Cognitive changes arise when networks that guide planning and language aren't getting steady perfusion. Seizure activity can flare as unstable circulation disrupts normal electrical patterns. Nausea and vomiting may appear when brainstem centers that regulate those responses are irritated, and brief losses of consciousness suggest transient dips in blood flow to critical regions. Abnormal tingling or pins and needles can surface as sensory pathways receive inconsistent oxygen and nutrients. The key is pattern recognition. Any single symptom can have everyday explanations, but a run of unusual neurological events over days to a few weeks, especially if they depart from your normal baseline, warrants prompt medical assessment. Clinicians are trained to connect these dots and can order targeted tests to evaluate circulation and stroke risk. 2. Sudden sensorineural hearing loss, SSNHL. The link between abrupt hearing loss and stroke surprises many, yet emerging clinical evidence points to a meaningful, and potentially life-saving, connection. When sudden sensorineural hearing loss appears, especially alongside vertigo or persistent dizziness, or in people with cardiovascular risks, it can serve as an early signal of an impending ischemic event, most often involving the brain's posterior circulation. Peer-reviewed reports describe SSNHL as a prodromal clue that may surface from several days to a few weeks before a stroke. Unlike the gradual decline tied to aging or noise exposure, this loss typically involves one ear and arrives quickly, frequently noticed first thing in the morning or evolving over the span of part of a day to the next. Concern rises further when this hearing drop occurs together with severe dizziness, balance instability, or in individuals with hypertension, diabetes, or known arterial narrowing. The inner ear and the neural hubs that process sound and equilibrium share key blood supply routes, particularly within the posterior system. When those arteries begin to struggle, the fragile structures of the inner ear often speak up first. Studies also note that the combination of sudden hearing loss with vertigo, or other neurological signs markedly heightens the likelihood of a future event in the vertebrobasilar territory that feeds the brainstem and cerebellum. While many conditions can affect hearing, the specific pattern of abrupt onset, especially with additional neurological symptoms or cardiovascular risk, stands out to clinicians as potentially vascular. Although SSNHL is commonly unilateral, unusually severe loss, involvement of both ears, or a history of carotid or vertebral artery disease raises the urgency even more. If you experience a sudden drop in hearing, particularly when paired with dizziness, imbalance, or other signs discussed in this video, treat it as a medical priority and seek prompt evaluation to investigate possible circulatory causes. 3. Fatigue or exhaustion. We often treat feeling wiped out as normal, but when the tiredness you're carrying is heavy, unrelenting, and out of proportion to your day, it may be more than a busy schedule. This isn't the post-work slump or the grogginess after a short night's sleep. It's a deep, whole-body weariness that refuses to lift. The brain is famously energy-hungry, drawing on nearly a quarter of the body's fuel, so it's especially sensitive to dips in blood flow and oxygen delivery. When circulation starts to struggle in the lead-up to a stroke, the brain can slip into a conservation mode. The result is a suffocating fatigue that doesn't match your activity level and doesn't ease with extra rest. This exhaustion often brings mental side effects: trouble focusing, slower thinking, dwindling motivation, and the sense that simple chores demand outsized effort. Many people who later suffer a stroke recall feeling unusually drained in the preceding weeks and chalking it up to stress, age, or the season. Prodromal fatigue, however, has a different signature. It tends to stick around day after day, resists recovery sleep, and can gradually intensify. You might also notice subtle cognitive glitches, word-finding pauses, brief confusion, or a persistent brain fog. That's your brain working overtime to keep functions online despite compromised blood flow, burning through its reserves in the process. If relentless, unexplained exhaustion is disrupting your routine and doesn't improve with adequate rest, especially when it appears alongside other neurological clues from this list, treat it as urgent and seek medical evaluation promptly. 4. One-sided weakness or numbness. Picture this: you reach for your morning mug and your hand doesn't cooperate, or you wake to a strange, flattened feeling along one cheek. When weakness or loss of sensation shows up on just one side of the body, it's one of the clearest early clues that a stroke could be looming. These one-sided changes, often called hemiparesis, weakness, or hemisensory loss, can precede a major event as circulation to key brain regions begins to falter. The motor and sensory pathways don't usually fail all at once. They can stutter first, producing intermittent glitches before a full shutdown. Early signs are easy to shrug off. Maybe your grip seems a touch weaker in one hand, your keys slip more often, or one leg feels a bit heavier on the stairs. Some people notice pins and needles, a patchy numbness, or an odd rubbery sensation along the face, arm, or leg on a single side. Because these symptoms may flicker on and off, they're frequently blamed on sleeping funny, a minor strain, or a busy day. What makes this pattern so concerning is its consistency. When the same side keeps acting up, it points to a specific area of the brain under stress, particularly the motor cortex and sensory cortex that govern movement and touch. And if the changes seem to intensify, from subtle to unmistakable, over a short stretch of time, it suggests that blood flow problems are escalating. Bottom line, recurring, one-sided weakness or numbness isn't a quirk to ignore. Treat it as an urgent signal to get medical evaluation before those brief glitches become a permanent deficit. 5. Speech difficulties. Language is how we connect, so when your words suddenly sound slurred, muddled, or strangely hard to produce, your brain may be raising a bright red flag. Speaking and understanding rely on a finely tuned network of regions working in sync, which is why disruptions in speech can be an early hint that something neurological is brewing. Neurology literature repeatedly highlights speech problems, including dysarthria and brief lapses in language, as early harbingers that can surface well before a full-blown stroke. The changes may be subtle at first. You catch yourself mispronouncing familiar words even when you're well rested, relatives mention you're talking more slowly than usual, or you find yourself pausing mid-sentence, searching for everyday terms. Some people notice the reverse, perfectly clear hearing, yet speech from others suddenly feels confusing, or hard to follow, as if the conversation were in another language. These clues arise because the brain's language circuits, typically in the dominant hemisphere, depend on steady blood flow to function cleanly. When perfusion dips intermittently in the lead-up to a stroke, those circuits can misfire. Broca's area, speech production, and Wernicke's area, comprehension, along with the connecting pathways between them, are especially sensitive to vascular strain. What makes speech changes so crucial is their specificity. Unlike symptoms such as headache or lightheadedness, altered speech almost always points back to the brain. If you notice new slurring, slowing, word-finding trouble, or difficulty understanding others, especially if these issues come and go, treat them as urgent signals and seek medical evaluation immediately. 6. Sudden vision changes. Your eyes are more than tools for seeing. They're status lights for your brain. When vision shifts out of the blue, blurred print that won't sharpen, double images that drift in and out, or a shadow cutting off part of your view, it can be an early clue that a stroke is forming in the background. The brain's visual network runs on steady, uninterrupted blood flow, which makes it highly sensitive to vascular problems. Clinical reports show that visual symptoms often precede a stroke, emerging days or even weeks beforehand. These changes can be surprisingly ordinary at first: words smearing on the page while reading, trouble judging distance in traffic, or intermittent double vision that seems to fix itself and then returns. Some people describe flashes or new blind spots that weren't there before. Because these issues can fluctuate, they're easy to blame on eye strain, fatigue, or too much screen time. But when circulation to the visual cortex is compromised, even subtly, your sight can become the first messenger of deeper trouble. The occipital lobe and related pathways, supplied by specific arteries, are particularly vulnerable when blood flow dips. If vision problems keep recurring or refuse to settle, especially alongside headaches, dizziness, numbness, or weakness, treat them as urgent. Those changes may be your brain's way of telling you to act now, before the situation escalates. 7. Dizziness or balance problems. Ever feel the room tilt or your footing wobble for no clear reason? A brief dizzy spell now and then can happen to anyone, but recurring vertigo or a lingering sense of imbalance may be your brain sounding an early alarm in the lead-up to a stroke. Multiple cohort analyses from leading cardiovascular and neurology centers have linked ongoing dizziness and gait instability to the prodromal phase of stroke, appearing not just days before, but sometimes a few weeks in advance. The reason is straightforward: regions that govern balance and spatial orientation, especially those in the cerebellum and brainstem, are exquisitely sensitive to changes in blood flow. When circulation is compromised, even subtly, these systems can falter. What makes this warning easy to miss is how ordinary it can seem. People often blame inner ear issues, new medications, dehydration, or just getting older. But when dizziness persists without a clear trigger, or shows up alongside other neurological clues such as a new, unusual headache, blurred or double vision, numbness, or weakness, it points more strongly to a vascular cause. Because the balance centers react so quickly to disrupted circulation, these symptoms can emerge from a matter of days to several weeks before a stroke, offering a critical window to act. If your world keeps spinning, or your steps feel uncertain without explanation, treat it as a prompt to seek medical evaluation rather than a quirk to ignore. 8. Transient ischemic attack, mini-stroke. Now for one of the most alarming red flags. Imagine your smile suddenly looks uneven, your arm feels weak or heavy, or your words come out jumbled. Then, just as quickly, everything seems to snap back to normal within minutes or a couple of hours. It's tempting to think, it passed, so I'm okay. But here's the hard truth: these brief episodes, known as transient ischemic attacks or TIAs, are often the dress rehearsal for a major stroke. Large clinical registries have reported that roughly 1 in 3 people who go on to have an ischemic stroke recall a TIA in the 10 to 14 days beforehand. A TIA is your brain's last chance warning. For a short window, blood flow to a region of the brain is interrupted, producing stroke-like symptoms that fade once circulation returns. What makes TIAs so dangerous is not their brevity but their message. They are among the strongest early indicators that a full stroke could be imminent. Because the symptoms disappear, many people downplay them and miss the opportunity to act. Don't. If you experience sudden weakness or numbness, vision disturbances, trouble speaking, or facial drooping that resolves quickly, treat it as an emergency. Your brain is giving you a preview of what's coming next, and the chance to stop it may be measured in days, not months. 9. The warning headache. Imagine this: you wake up and suddenly feel a headache that is nothing like the ones you've had before. It isn't the dull pressure of a tension headache, nor is it the throbbing rhythm of a migraine. This pain feels sharper, heavier, and refuses to ease even after trying your usual fixes. Doctors call this a warning headache, a term used to describe the brain's early alarm system. In one clinical study that tracked over 600 participants, researchers discovered that nearly 1 in 5 people reported this kind of unusual headache in the days leading up to their stroke. What makes these headaches stand out is how different they are from your normal patterns. Unlike migraines, which may come in cycles or fade after rest, these warning headaches are stubborn, often intensifying as the days pass. They can strike suddenly and linger relentlessly until the stroke finally occurs. Experts now view this as your brain's desperate signal that circulation is already being disrupted. If you ever notice a headache that feels completely foreign, more severe, more unshakable, and lasting far longer than usual, it should never be brushed aside as stress or lack of sleep. It may be your body's urgent call for immediate medical care, a chance to act before tragedy strikes. When you connect the dots, your body often speaks up before a stroke, a strange, relentless warning headache, brief mini-stroke, like spells, persistent dizziness or loss of balance, sudden changes in vision, slurred or halting speech, weakness or numbness on one side, crushing fatigue without a clear cause, abrupt hearing loss, especially with vertigo, and other unusual neurological clues like confusion, nausea, fainting, tingling, or brief seizures. These signs can surface over days to weeks, your golden window to act. If any of these changes appear, especially if they recur, intensify, or cluster together, treat it as urgent. Remember fast, face drooping, arm weakness, speech difficulty, time to call emergency services. Early action protects your brain, your memories, and your future. If this video helped you, please subscribe, hit the like button, and turn on notifications so you never miss our next life-saving guide. Share this with someone you care about, and tell us where you're watching from in the comments. We love hearing from our global health community. Your best defense starts with noticing small signals and choosing to act today.